Oh, it is now July. Hard to believe, huh? We've been at this since when? Oh, it's been a really long time. So as of today, we have 9,999 cases. We still stand at 29 reported deaths. We don't have anybody in the hospital. 252 of those cases are home and 718 have recovered. So we have 252 active cases. Our case fatality rate now is 2.9%, and we are monitoring 55 people completed 100,007. Salesforce is a collaboration with the state. So the monitoring through the state via a Salesforce is also shown here. Active 237, completed 172. So our daily hospitalization still looks like a really great trend. Now keep in mind, these are only Ingham County residents. Our hospitals hold residents of other counties frequently. So I don't know those numbers. I only have Ingham County numbers, but as of today, there is no one in the hospital from Ingham County for COVID-19. So our status is that 71.9% of our cases have recovered, 25.2% are active but at home, and 2.9% deceased. So our graph that we were waiting for a plateau on had plateaued, and as you know, recent events have caused those to go up. We are not unique in the fact that there's some trending upward across the state, but we certainly have experienced a fairly significant event here that is contributing to that in Ingham County. So if you look at our daily incidence curve, you can see that we had numbers, back in April when things were bad, and now we're here. The good news about that is, if there is good news about that, is that when you look at what was going on back during these months, we had community transmission. Our ability to contact trace and test was more limited than it is now. Our ability to actually identify a source and quickly contain an outbreak was different, because it was really just challenging to know where all of these cases were coming from. Right now we're zeroed in on a few things that these cases are coming from. And so we are, as you can see, quickly getting those numbers to trend back downwards. Hopefully that continues. This is what our percent positives per day look like. So that was trending down and also trended up during our basically our incidence of higher cases. But again, that's trending down. So one of the things that you can say about some of these increases in cases, where did my mouse go? There it is that a lot of people are going out and getting tested right now as a result of hearing everything that's going on. So even though we have more cases, our percent positives per day are, after peaking out on the 22nd, 23rd, are starting to trend back down as well, which is a good sign. When we look at those on a 7-day rolling average, you can see pretty much what I just told you, which is that our current peak exceeds where we were in April and March. It is the highest peak we've seen so far in terms of cases, and it is on its way back down, as is percent positives per day on their way back down. And that honestly is basically a lot of hard and wonderful work done by our disease control team, case investigators, contact tracers that are either part of that team or part of our other staff or volunteers or just from all over the place, doing just an amazing job of quickly containing some outbreaks that we've seen recently. One particular we'll talk about at the end of this that has been, obviously quite large. So now when we look at our zip code map, 48911 is still out there in terms of our highest range of cases, but hasn't really changed a lot. What we've seen is 48823 jump way up, and that is associated, of course, with the outbreak related to Harper's restaurant and brew pub largely. So now our map, when we look at cases, just by case number, we see 48911 as our highest rate, 48823 Lansing as the next highest shaded area, and then we drop into 48910, this color, and then this is actually a lighter shade of blue than this in these zip codes here, Mason, Okemos. I think this might be 48915, and this is 48906, I think. Somebody can correct me on that if I'm wrong. I'll still claim I'm new to Lansing, so even though it's been 6.5 years now. So when we look at that by rate, 48910 is still our highest rate, followed by now East Lansing at the lighter shade, and also right in here, what these zip codes right in here also. And then we taper off from there. So our heat map, when we look at cases by heat map, show basically what's going on across the county, and we zoom in on that a little bit and we get a little bit better idea of heat density maps. What this shows you is that in 48910, which is a fairly small zip code, we had a lot of concentration in specific places, whereas what's going on in 48823 right now is just a little bit more dispersed. You've got a couple of hot spots, but all of this shading that's a little pinker that's just kind of everywhere. While there are a lot of cases there, they're not concentrated in places. Some of that was due to some fairly crowded apartment complexes and housing that was going on in 48910 that we've talked about, and that just is not the same kind of trend we're seeing in 48823. When we look at our cases by sex, they are 51% male and 49% female. By age group, we are now 29% in our 20 to 29 age group, and that has changed dramatically in the last, I'm forgetting how long it's been now, but it's about, we're almost 2 weeks into the outbreak associated with Harper's restaurant and brew pub, and that has driven up our case rate in our range in the 20 to 29 age group. And actually, per the governor's media briefing yesterday, that is a trend we are seeing statewide as well. So right now, almost 30% of our cases are in our 20 to 29 age group. When we look by race, we're 53% Caucasian, 25% Black or African American, 13% Asian, 7% other, and 2% unknown. We look at that by prevalence rate and adjust for population where we know that we don't have the same representative population of African Americans or Asians in our community. And so just looking at percent does not truly tell you the impact. We have to say, well, if there were 100,000 Asians in Ingham County, or if 100,000 African Americans in Asian County, how many cases would there be? If there were only 100,000 Caucasians in Ingham County, how many cases would there be? And so you see this differential where we're about 3 times the rate of Caucasians with our African American population, and a little less than that with our Asian population. We are 84.4% not Hispanic or Latino, and 9.7% Hispanic or Latino, 5.9% unknown. So that prevalence rate, similar explanation of what we have to do to adjust for population, 312.6 for not Hispanic or Latino, 420.6 for Hispanics or Latino. So certainly not, the 3 times the amount, but certainly an increase over what we're seeing in our non-Hispanic or Latino population. If we look at deaths, this is an unchanged number because we haven't had a new death in quite a while. So we still are at 13.8% of our deaths 50 to 59, 17.2% of our deaths, 17.2% of our deaths 60 to 69, 27.6, 70 to 79, and 41.4 over 80. So that 70 to 79 and over 80 We have seen that trend since the very beginning of this, when this outbreak started in Wuhan, where largely the deaths were happening in our over 70 population, and then increasing even more than that in our over 80 population. So those two populations together, the predominance in terms of deaths in the county, as well as nationwide and worldwide. If we look at deaths by sex, we are 51.7% male and 48.3% female. And if we look by race, 62.1% Caucasian, 31% African American, and 6.9% other. And I think the next slide is going to get us to, oh, here we go, ethnicity. 86.2% not Hispanic or Latino, 6.9% Hispanic or Latino, 6.9% unknown. So Harper's Restaurant and Brew Pub, we are currently at 138 cases related to that outbreak. 119 of those cases are what we call primary cases. That means that they are known to have been exposed and then become COVID positive as a result of exposure directly at Harper's Restaurant and Brew Pub. The age range for those primary cases is 18 to 28, with an average age of 21.2. Then we have 19 what we call secondary cases. Secondary cases are individuals who were not at Harper's Restaurant or Brew Pub, but were close contacts, household contacts or otherwise, of individuals who became ill as a result of that exposure and are now ill as a result of an exposure to someone who became ill at Harper's. So the outbreak in total adds in primary and secondary cases, but we do distinguish those primary versus, secondary transmission. In other words, somebody that passed it now on to somebody else. We don't have any hospitalizations related to these 138 cases. I will tell you also, I didn't make it clear, those 138 cases are total cases attributed to this outbreak. Since the outbreak is happening in our county, we have all of the outbreak numbers. I'm going to show you the breakdown of Ingham County and other county numbers. So these are not all Ingham County cases. So there are no hospitalizations. 36 of those are asymptomatic, and that includes primary and secondary cases. So we look at Harper's Restaurant and Brew Pub COVID cases by onset date, and we see June 13 out through June 27th as onset dates of symptoms, and we do have one now on the 29th. So in terms of incubation period, with the establishment closing on the 20th, we are starting to get to the end of that, likely incubation period. Incubation period for COVID-19 on average is about 5.5. On the longer end is, say, 9 to 10 days. 14 days is possible, but is at the far end, and that is why we do recommend quarantine for 14 days. So we are starting to taper off, clearly, because we're getting to the far end of what would be an incubation period as a result of the last possible exposure at Harper's Restaurant and Brew Pub on the 20th when they closed. Onset date and referral date, here's the difference between that. Onset date is basically saying, okay, you are sick, you're confirmed, and you have symptoms. And so we know when the onset of those symptoms were. I told you we had all of those asymptomatic cases. When we look at asymptomatic cases, we have to basically give those what's called a referral date. In other words, what day did they test positive? So the date that those asymptomatic cases tested positive is when they will be charted on a graph. There's no way to tell when those people actually became COVID positive because they don't have any symptoms. So all we know is by test date. If we look at those primary cases, 75 of them are in Ingham County, or 63%. We have 9 now in Oakland County, 8 in Wayne County, 8 in Clinton County, 3 in St. Clair, 3 in Macomb, 2 in Livingston, Ottawa, Kalamazoo, Eaton, Shiawassee, and now 1 in Manistee, Berrien, and Calhoun. 14? I'm counting 14, I think. It could be 15. I meant to do that math before I got on live. But anyway, so it was 13 counties as of yesterday. I believe we added Manistee County today as one of our counties with cases. The secondary cases are largely in Ingham County, although we have 5 secondary cases now in Oakland County, 3 in Wayne, 1 in Shiawassee. So over half of the secondary cases in Ingham County. And that is the end of the data for today.
Does anyone have any questions for Linda Vail? Go ahead, Dave.
Hi, Linda. Dave Ackerley here. Have you seen the news today regarding Beaumont Hospital, and their new lab test for detecting COVID-19? This they've developed to take via urine, blood, saliva, or mouth swab and have results in about a half hour to 45 minutes. And what was your impression of that overall?
I haven't seen that. I knew that Beaumont was working on an antibody test and basically doing trials over it. So I'm going to presume that basically that is that's a study for that as well. My impression of the ability to do that is that that's a wonderful thing. Hopefully we can prove that those are basically viable, test results don't have a lot of false negatives and false positives to them, but certainly the faster that we can identify a case, get that person isolated, and then get contacts to that case quarantined, the faster we're going to be able to get things contained. We were having a turnaround time of a matter of hours with Sparrow with the test that existed. So, it's 4, 5, 7, 8 hours, sometimes maybe 24. So we were still fairly quickly identifying them, but quicker methods to identify are going to be helpful.
Would this be helpful with, we had one provider yesterday say they're worried about a shortage coming because of huge outbreaks in other parts of the country. Would this be something that would be helpful if that were to come? This person said, and they didn't want to go on record, but they are involved in lab work in mid-Michigan. They said it's coming because we know we're not going to be able to get our hands on the amount we have been due to what's going on elsewhere. Would this be helpful in that regard?
Oh, yeah. We're looking at, basically capacity. We've been fortunate for a long time in Ingham County to have the capacity that Sparrow Hospital has had. And so we are now at a point where, increased testing capacity is critical. To the extent that we get this contained, we go back to, we are well within our limits of testing capacity, but we must have the capacity to do the testing, to do the effective isolation quarantine in order to contain these little outbreaks, which we expected these little mini outbreaks to happen. I don't think we expected one quite this large at this point in time. So yeah, I would agree with that.
Thank you.
Go ahead, Megan Danza.
So actually kind of speaking back to those little mini outbreaks, how many of those would you say that you guys have had to trace? I know maybe like outside of medical facilities.
There are 4 or 5 that are just really small things that we're kind of tracking down right now. Some of them are connected to the Harper's outbreak, others are not. So we don't have a ton right now, but we are seeing just, little bubblings here and there. And, honestly, the ability to contact trace and things like that is helping us identify, certain just specific outbreaks, which allows us to quickly control them. That probably was happening all along, but again, the community-wide transmission really clouded over our ability to do some very specific and targeted contact tracing that allowed us to contain things quickly. So I don't know the exact number right now, but I have heard of a handful.
Okay. Were there some earlier in the pandemic?
Specific outbreaks?
Correct.
Oh, we had the ones in our nursing homes or long-term care facilities. Let's see. I'm trying to remember others, Herbrooks, Meyer Warehouse, all of the outbreaks that we've talked about before. But other than that, no.
Okay.
We did always see household contacts. It's like, okay, you've got a household contact, and that person became positive. So, but that's not necessarily an outbreak. We're looking for outbreaks in facilities or related to a specific location or establishment, like has happened with Harper's restaurant and brew pub.
Thank you.
Mm-hmm.
Next, I have a question from T. Samilton via chat. It reads, we've heard from a local healthcare worker that a grandparent of one of those infected in the Harper's outbreak is now in the hospital. Anything to that? Sparrow Hospital.
Somebody asked me that question yesterday, and it turned out not to be true. What I heard was somebody over 70 or 70 years old was in the hospital related to it. The oldest we have is 63. So even though I can only tell you about Ingham County data in terms of hospitalization, I also do have the full outbreak list from our state epidemiologist. And the age range on those secondary cases, as you see, goes up to 63. I don't know whether that 63-year-old is a grandparent or not, but none of those cases are hospitalized.
Thank you. Rachel Sweet.
Hello. So my question is, how far do you expect this outbreak to go? And why has, particular to Harper's, and why do you think it hasn't spread or happened in other restaurants and bars?
I haven't been at other restaurants and bars to tell you. I do know, a lot of things that happened at Harper's restaurant and brew pub that were problematic. As much as they can basically put tables 6 feet apart and do all of the other things that were required in the executive orders, the extent to which, it is required that people wear masks indoors, but places are not willing to deny people entry. I would encourage them to do so, or else we'll continue to see things like this and we'll see bars and restaurants close. So we're trying to avoid that. There was a huge line outside. Despite being outside, those were people very clustered together for extended periods of time, which is risk. Then if you look at what was happening inside, until they bolted tables down, apparently tables were being drugged together. People weren't even sitting at tables. The executive order says you can take off your mask once you're seated at your table to eat or drink. So there should not have been any non-mask wearing. I think the rest of it has to do with probably loud music, which results in shouting. And we know from news reports of, choirs and things like that, where many people have gotten ill, and we're talking about singing and basically those kinds of things that project droplets or aerosols further than that normal 6 feet that is a safe distance. So that 6 feet is no longer a safe distance when we're singing and in a crowded, large bar or restaurant, people are shouting. And that doesn't help either.
And I have a follow-up question, not pertaining to Harper's, but pertaining to the weekend. I know it's 4th of July weekend. A lot of people will be going out on boats, and who knows what people will be doing. Do you think that there may be some more bubble ups after this holiday weekend?
I don't think we saw a terrible bubble up after Memorial Day weekend, but a lot of things weren't open. We all have hope that this has created a aha moment, some additional concern. This has been huge. It has received nationwide media attention. Mayor de Blasio mentioned this particular outbreak in East Lansing as a reason to rethink his decision to open indoor dining. And I heard today, while I was talking to a reporter from the Wall Street Journal, that he has indeed decided to only allow outdoor dining. So this influenced that decision. So hopefully it will also influence the decision of individuals in this community and in this state who are also hearing all this news to basically be more diligent and not let down their guard about the very real and present danger. There's a book that's Clear and Present Danger. That's the name of it. But it's still clearly a dangerous situation in terms of keeping transmission under control. Then becomes dangerous when older people get exposed and we start to have more deaths. We've been very fortunate not to have a death in a very long time. And the last thing we want to see is people becoming seriously ill, hospitalized, and looking at more deaths in this county. So, hopefully, and I've heard a lot of people just go, this has given them kind of an aha moment. And so people need to remember not to let their guard down. The measures that we have asked people to take are not just things we pull out of the sky. They're not knee-jerk reactions. They are science-based. They are appropriate when it comes to mask wearing and social distancing and staying home when you're sick, as well as the hand sanitizing and not touching your face. I refer to those as layers of protection. Doing any one of those things is not really going to eliminate your risk. But the more of them that you put in place, it's like putting one shield in front of another, in front of another, in front of another to reduce the likelihood of transmission of the virus. Pull any one of them out and the risk level starts to go up and up and up.
Thank you.
Does anyone have a question for Linda Vail? Go ahead, Ben.
Hi, Linda. Ben Gretchko here. One of the things that I saw on one of the graphs was not only that the age group has shifted, but also the race, the race groups. Early on in the outbreak, there were some disproportionate impact. COVID-19 had a disproportionate impact on people of color, and now we're starting to see it shift a little bit. Do you think there's a definitive reason on why that's happening?
Well, first of all, you still do see that disproportionate impact, in looking at the countywide data where, the rate for Caucasians is 245 and the rate for African Americans is 754 and Asians 693. So I will agree that it's not as extreme. And keep in mind, I was also showing you 48911 data where those disproportionate numbers were even more significant. And we're not even talking about 48911 right now because this became the more pressing issue. But I will tell you that the vast majority of those who have become ill due to the Harper's restaurant and Brew pub outbreak have been Caucasian.
Okay. And then another point to that is because we are seeing an increase all around the country, and we're seeing it's not as bad here in Michigan, but we're still seeing an increase. Could we, I think back to 2-3 weeks ago, and I think that was the period of the protests. Could we say that the protests may have a link to the increased COVID-19 cases just overall?
I would have a tendency to place it more on the opening of bars and restaurants on the 8th. So the last significant protest we had here, and we're not, in terms of our contact tracing, we're not finding anything that is pointing to that. And all of those questions get asked. Where were you? Who were you with? Those sorts of things. So identifying protests or any of those sorts of things would be part of that case investigation and contact tracing. And so, while that's possible, again, you've got an outdoor environment rather than indoors. I've already said outdoors clustered that close together can still be hazardous, as can shouting. The protest that I did attend in Lansing, I would say it had to have been about 90% mask compliance at that particular protest. So we're not seeing that indoors in bars and restaurants. When I look at pictures indoors at Harper's that were taken and tweeted out by people or whatever, I've yet to find a mask on anyone. So, we've not tracked anything to those protests. And keep in mind, those have been going on since April here, and we didn't have any uptick in cases due to April protests. So I'm not necessarily seeing that connection. I won't rule it out, but we're not seeing a line that's drawing us to that right now.
Megan Danza?
So Governor Whitmer just put out that she signed an executive order stopping in service at bars through most of Lower Michigan. Will that impact your order about capacity at all?
We will have to look at it. My understanding was that was not a complete restriction of indoor dining.
Yeah, it looks like just bars.
It had to do with the percent of sales that were liquor versus food. So I think it primarily impacts bars. So there are some bars that are going to be impacted by that. And, honestly, I think they were going to go back to maybe last year's sales in order to figure out this whatever percent number is. But yeah, that does give us a reason to go back and look and see what we can do related to that. But right now, one of the other reasons for that order was we need bar and restaurant owners to get accustomed to the idea that they can indeed deny entry. They can ask somebody to leave if they're not wearing a mask. They can tell people to go back to their tables and not cluster around. And they're going to be able to do that easier with a smaller crowd to manage. And what I'd like to see is them taking that responsibility, managing that responsibility, and then we can increase numbers. Now, that doesn't mean that we won't increase those numbers or do something about that before the 16th, which is our current order, but we've got to really evaluate how the new executive order impacts the order that we have. I mean, I did a lot of looking at fire code capacity of bars and restaurants in Lansing and East Lansing. I didn't go beyond that. So like Lansing Township and Mason and those places. So, we really need to evaluate further what places are going to be impacted and what is the relative risk of those, especially since those places that primarily are alcohol serving or bars rather than restaurants are being further restricted beyond even what we have just restricted. So I don't have an answer to that yet. Got to do some evaluation. The order I issued yesterday, despite being accused by at least one person of it being a knee-jerk reaction, was not a knee-jerk reaction. We couldn't continue to allow what was going on happen and continue to let it happen in more places. And we definitely had to do something to get a handle on numbers. We have an executive order that only allows 100 people outdoors in a gathering and 10 people indoors. For example, if you went to, let's say the Henry Center where they have conference rooms, that's not a bar or a restaurant. They're allowed to have 10 people in a room, no matter how big the room is. But bars and restaurants were at 50%. And so a large one, 500-600 people, 250, 300 people inside. And so getting that number, that cap down, and then basically being able to get bar and restaurant owners with some experience in being able to manage those crowds in an appropriate way for social distancing and mask wearing, so that we can then allow them to continue to manage it with larger crowds is all of what went into that decision.
Okay, thank you.
Mm-hmm. Does anyone have any questions for Linda Vail?
I do. I spoke with Scott Ellis, the communications director for the Michigan Licensed and Bar Association. He mentioned that the 75 number was a little bit, he found that there was no premise behind the 75 number, was a little concerned that that's affecting businesses and bars negatively. He says he's having a conversation with you later today to see if that number might be adjusted. Do you think that this is something that we could see increase, or it's going to stay set?
So, the 75? Mm-hmm. Like I just said, that is something that is in place now. We're going to give a little experience with it. It's certainly something that we can look at. And I actually talked to him before we got onto this. And so we did talk about some potential solutions for some places, as well as, options looking forward. This order is only in place until the 16th. Again, the governor has now put an executive order in place on top of it that will cause us to need to go back and reevaluate how that then impacts certain places that are pretty much, sit down, eat only places anyway. I needed to make that decision quickly because of what was happening in East Lansing and then spreading all across the state. I mean, look, we've impacted the whole state. So what I need to do at this point is go and take a look at fire code capacity of places like Lansing Township, Mason, Holt, those sorts of things, gather all that information. That was part of what I did. It's like I sorted them by capacity. I said, if we go down to 75, which I felt like we needed to go below the allowed outside number, it's only safe to have 100 outside, then why is it safe to have more than 100 inside? So we just need some more time to evaluate before we'll change that. And we also need to look at the impact of the governor's executive order on how that manages the situation without necessarily the need for this additional order. Now, he's Michigan Licensed Beverage Association, so a lot of the bars are the ones that he's most concerned about in terms of capacity limits. And what I did yesterday is now moot in terms of a lot of those places, because clearly those places that are mostly bars have now been restricted even further than what we've restricted.
All right, thank you.
Mm-hmm.
Anyone has any questions, please feel free to go ahead.
I think Amanda put a tickler in here for me. I'd like to mention that the Grosse Points related outbreak is being identified as a separate outbreak, but yet does have some connection to what's going on in Harper. So those numbers are not part of the Harper's outbreak number. Those are completely separate. It's got a different outbreak identifier. I think part of that is because I think there was an individual there from Harper's that was probably symptomatic, but there was somebody else there that had not been to Harper's. And so it's really hard to say that's totally attributable to and belongs in the Harper's outbreak. So there is a connection to those two, as has been identified in the paper, but they are separate outbreak identifiers right now.
Looks like we have a question from Ben.
Yeah, I do apologize. I know this is my second go around. I know the governor, New York governor, oh my God, Governor Cuomo was going to postpone the reopening of indoor dining. So I guess my question to that is, if any governor were to do that, any other governor were to do that, what would you say to them? What advice would you give them as to whether they should postpone it or not?
Well, first of all, I understand it was Mayor de Blasio. So New York City. Is it statewide? I'm not aware of that. Huh?
It's statewide. He just announced it today.
Oh, okay. Thank you. So, that clearly is another option in terms of controlling transmission, is to limit dining to outdoors only. But as you can imagine, that really limits options in a town like ours that has very limited outdoor dining. You go to certain places, major cities like that, and outdoor dining is just everywhere. And so they have a larger ability to do that. As we continue to look at transmission rates increasing, rather than just closing down bars and restaurants completely, could we go to outdoor dining only? I think that's a great idea, but are we there yet? That's kind of the governor's call. And right now, my order just basically took the governor's existing order, didn't change things like, indoor versus outdoor. People talked about, shouldn't we just, say there can't be any dancing, things like that. There was nothing like that in her order. I didn't want to do an order that was really complicated compared to what was in place. All it did was take that 50% capacity and cap it at 75. So, you know, we try not to get out in front of the governor too much, but we also have to take actions on the local level. And when she opened things, she specifically said that locals are still have the authority to do things even stricter if that's what they need to do. So, you know, Florida and Texas closed them down completely. It's just a matter of how you handle it.
And Whitmer, I think actually someone just mentioned this, that the Governor Whitmer just ordered the closure of indoor bar service. If there was an outbreak that stemmed from a restaurant in Ingham County, like if this kept continuing, would you recommend that restaurants entirely close in Ingham County?
I'm just going to say that we have to wait for there to be a reason to make that decision. Right now, I'm sorry, I got a tickle in my throat. Right now, we see an outbreak that's largely attributable to a single facility, a single bar and restaurant. I would by no means, and I'm already, you know, it's like the 75 thing, and, you know, the Michigan Liquor and Beverage guy is like, oh, can you please change that? You know, it's like, you know, you're already kind of taking care of the many by the actions of a few. And so I don't think we want to further create, you know, punitive measures that affect everybody when there are just a few that we need to address. So right now, what we need to do is look at what the governor's order does in terms of eliminating some of that more crowded bar-like activity versus what's going on at seated restaurants, and see where we go from there. Really too early to make those decisions, Ben.
Rachel Sweet, go ahead.
Maybe this question kind of follows off of that question he just asked, but like he mentioned the governor's order and the emergency order that you guys have. What happens if the bars or restaurants don't comply? Is it the same type of things you guys have been doing before?
So here's what happened, my understanding, on a call that I was on from the state. And that is when things were closed, the enforcement was under Michigan law with a misdemeanor penalty. And we used law enforcement and the prosecutor and those sorts of things to keep businesses that were closed. When things opened, according to Lara, the enforcement then lies with the licensing authority. So we are the licensing authority for bars and restaurants. Now, their liquor license comes from the Michigan Liquor and Beverage Association. So, or not association, but from the Michigan Liquor Commission. So it will be something that, you know, our staff are going to have to work with enforcing, and we'll probably have to have the commissioner of the Michigan Liquor Commission has already reached out to me, Geraldine Lasher. So, you know, I will talk to her about how we're going to look at enforcement when it's largely, you know, based on liquor sales. But all of those are also licensed by us as bars and restaurants, and will be our responsibility to enforce.